So this is your small volume nebulizer, which you put your medicine in. Just gonna pop this off, and you would take that little canister, that red one right here. Open it, put it inside. There's an amount of liquid that you have inside of this nebulizer, so whenever you start your medicine, what I like to do is like to put the mask on the patient first before starting. So I'm gonna put it on them like this. Make sure you put it around the ears, do the whole thing. Make sure it's kind of good tight right here, and you're gonna turn it. Huh?
Has
Oh right, yeah. We're not gonna do that.
Yes.
So I forgot the machines. So you're gonna turn it on, and this is gonna be on their face. You turn it on, you wanna make sure that you see a mist. That means the medicine's coming out. Put that on their face. It lasts for about 5 to 8 minutes. Watch your patient while this is happening, because anything can happen to them fluctuating with an albuterol, making a heightened respiratory rate and heart rate. That can happen. So you wanna make sure that you're looking at their vital signs, looking at them, make sure the medicine is being administered to them. So that's with this. Alright, we also have make sure that you see the mist coming out. You're gonna have them purse their lips at this end, breathe in, it's the exhalation valve, breathing out while their mouth is shut, and administering the medicine that way. Again, watch your patient. You never know what's gonna happen while the medicine is being administered. Watch the vitals as well. So that is that. And you'll see how it's filled up right here, moving around, misting away, humidity, all that.
So there's multiple ways of administering medication with the mouthpiece, with the mask, somebody who cannot hold the mouthpiece. You know, we have different ways of doing it. So that way there is no, okay. Any questions so far? No? Okay. Vanya's gonna show you how to.
These are, this is another way for administering the medication. So these are MDIs. This is an MDI with a spacer and a mask. So if you have like a young child or a baby who can't do these themselves, you can do it with them. So you put the mask on the face and press, and then wait a while until the baby, so they can breathe what's in the spacer, and then these are regular MDIs, and adults or children are usually taught to use them.
You can pass them around. The only reason why we use a spacer, the little chamber, is babies and kids cannot coordinate breathing. So it kind of gives them that time. Versus adult, we can instruct them to coordinate their breathing so they can take a breath in.
This one has, they go down as the dosage.
Yeah.
Is it okay if I can?
Sure. How you use it is you open that little cap. So you would have to open this, okay, and then press down on it. So as you press down, you'll hear a little hiss, and that's how you know that you got your medication. And then you can just close it, and then store it in your drawer or something.
Does it tell you how much is left? Or?
Yeah, so the newer technology or the newer generation of it will come with a little dial, and it'll go down as you use it. But the older generations don't. The only way to know is that you just press it out in the air, and if something's coming out, then you're still good. Yeah.
With the medication.
Yeah, we're back down to normal.
Okay, so it's like this.
Yeah. So after, imagine you got your medication. Now you're feeling better. You don't sound as wheezy, right? So now you're not you're feeling better. So your heart rate came down, your respiratory rate came down, your SpO2 went up to 97. So this is how you would assess your patient to make sure that what you did actually worked. Okay.
Okay, and another way to deliver aerosol is, this is a large volume nebulizer. You would fill this with water, and this attaches like this. So there are different masks you can use. This one is a face tent, and it would be for like surgery patients or patients with facial trauma who can't use a regular mask on their face. And then if they can use a regular mask, that's they use a regular mask. And for a trach patient, they have a trach collar. You attach it the same way. So if their trach is like right here, you would sit the mask on top. Tie it back.
Has anybody seen a tracheostomy in their neck? They're not very common out in the world, but they're very common in the hospitals. So where they're breathing through their neck for a longer period of time, and you have to be able to administer oxygen medications through that. So that's why there's this mask shaped like where it just fits right under your neck. Okay, they're called the neck breathers. So you might see, if you pay close enough attention at like your local grocery store or something, I've definitely seen people, sometimes they're hidden very well with a scarf or something, but you'll see that. So at the airports, grocery stores, they have them out there. Patients are walking around with it. So yeah, but that's how you administer oxygen or medications. Go ahead.
So to set this, it uses an air treatment. So basically, if the patient requires 28%, for example, then it tells you that to dial it in at 5 liters. So it's connected here, you do it 5 liters. And then if the patient requires, for example, 80%, you would do the same thing. And on here, 80% is 10 liters. So the difference is from this gap, 28% would be at 5 liters, so it would be entraining more air from the room. And 80% the gap is smaller, so you'd be getting more oxygen and less room air.
Any questions so far? There are multiple ways of administering oxygen therapy, medications. So we have a different way of doing it. If somebody is claustrophobic, then they have a bigger mask with an opening at the top so that they're not, a lot of people are claustrophobic and it's a real thing. So they're not panicking or, sometimes you don't have these available and we utilize something like this. It's pretty closer to their face. And then obviously we talked about the one with the neck that goes right over the neck. Yeah, that's about it. Anything I'm missing?
Then just like anything else, do your post vitals with the
Right.
stethoscope, listen to breath sounds again, check their pulse. You want to always, look at your computer, the system, and see how their vitals are. But you also got to look at your patient and check for yourself, because sometimes that's what we learned in the beginning. It's the patient, not the machine. So make sure that that's reading what they're doing. So you always want to make sure of that, because things can happen, malfunction, and they're the patient and they're not the machine. So make sure that you assess them and everything's looking A-okay.
Very good point made. Technology is everywhere. You want to look at your patient, right? If the patient is breathing fine, doing okay, then you're okay. But other than that, like besides looking at the monitor, because that could be wrong. You know what I mean? So, yeah.
It's Jackson.
Any questions?